It's my pleasure to serve as the 2021-22 president of the American College of Emergency Physicians California chapter. I'm very honored and grateful that this year also happens to be our 50th anniversary as an organization. This milestone deserves celebration, recognition, and a look at our long and successful past. Our mission remains our guide to support emergency physicians in providing the highest quality of care to all patients and to their communities. These are challenging times for our specialty and our members. Sadly, we're still fighting COVID. The demoralizing feeling of caring for so many unvaccinated patients who could get vaccinated that now want science's help is hard to endure. Now the situation is compounded with a serious nursing shortage. Increased boarding times, devolved workflows due to short staffing, and an increase in the need for mental health services during the pandemic is further impacting our work environment. It's all enough to cause me to ask myself, is this the job I signed up for? And would I do it again if I had the chance? The answer is definitely yes. I humbly grew up on the East Coast as a child who yearned to be able to independently provide for myself. Drawn to the sciences in general, becoming a physician was a good way to do that and also to help others. I attended college at the University of Michigan, medical school at Loyola University Stritch School of Medicine, and then completed an EM residency at Resurrection Medical Center in Chicago. I chose emergency medicine because, like many of you, I loved every part of medicine and also enjoyed being there to help. We all need similar things: care, value, and respect. When we practice emergency medicine, we're there to help. We aren't selling any service or procedure that might not be needed. We're always needed, and that's a fulfilling reality. I stayed on in Chicago as a nocturnist at Resurrection for a number of years as a residency core faculty member before I moved to Visalia, California 10 years ago to help CALACEP Health build residency programs and fellowships. Currently, I still work clinically in the emergency department, and I'm also vice president of medical education for CALACEP Health. In addition, I help my physician partnership in the education realm and serve as Vituity's Director of Academic Affairs. My position of administrating residency programs in multiple specialties affords me a wide lens to view the current workforce issues that are frightening our newest members. As is appropriate in the 50th year of our existence, I appreciate that we are a specialty born out of perseverance, determination, and hard work on behalf of emergency medicine. I think that because of those tendencies, we will work hard to pivot and adapt, as we always do, to come out on top. I think other specialties are not so organized or gritty. We must remember that our strength is in acting, advocating, and speaking together as one. And I applaud National ACEP's work to identify at this very early stage ways to address the supply and demand opportunities that will avail. As healthcare's safety net, we realize that the system is awfully broken in no small part due to the payment structures that continue to strangle our right to fair payment. Reimbursement issues, including banning balance billing, bad payer practices, and threats of rate setting, require a deep understanding of the finances behind the delivery of healthcare in this country. That expertise is important to cultivate among our members so that we can continue to be at the table and represent emergency medicine. Your support of CalACEP through membership and advocacy is what's going to make a big difference for your own practice future. I'm very proud that CalACEP is so active and experienced in the legislative arena. I look forward to the advocacy work we will do in the coming year to improve our practice and the lives of our patients. We face many challenges in the years to come, but emergency physicians are accustomed to working with every specialty in the highest stake situations. Because of the nature of our work, we are natural leaders, and I am confident that we will be able to protect our value as leaders of the healthcare team. Across the nation, our specialty is seeing lower numbers in organized memberships. Considering what we're facing together, it's more important than ever to join and not only enjoy the rewards of the chapter and the national advocacy efforts, but to do your part to help make those energies that much stronger. Thank you for your membership, and please consider helping to explain the benefit to your colleagues who might not be members. On behalf of myself and our CalACEP board, we look forward to serving you this year.